Hello, my name is Donna Winges. I'm the owner of Back to Balance Acupuncture, and today I'd like to give you a little bit of an introduction as to what you can expect at your first visit. If you're a new patient of mine, you've gotten a welcome email and you've gotten a link to the patient portal, and I hope that you're going to be willing to fill out those forms online. It'll save us a lot of time in your appointment. That first appointment, I do set aside 90 minutes. You have me all to yourself. You have the office all to yourself. I don't schedule any other patients during that time. When you get there, you may see my previous patient and they'll be getting ready to go. There'll be some other forms for you to fill out. You need to sign that consent in person, so I'll have that for you to sign. If you're using your insurance, you might have to fill out another couple of forms, just what we call outcome measures. So you'll fill those out at the time of the appointment. But I'm really hoping that you're going out to the patient portal and filling out all those forms online. That will give my biller time to do the insurance verification to make sure that your insurance will cover your visit. And it'll let us know how much we're supposed to collect for either your deductible or your copay. So we'll get that financial stuff out of the way. The next thing that we'll do is we'll go into the office and we'll sit down and we'll talk. We're going to talk about the information you gave me on the forms. I'm going to have some more questions for you. Some of those questions are going to seem a little bit unrelated to why you came in. If you're coming in for shoulder pain, I'm still going to ask you about your bowel movements and urination. It's really important for a full Chinese medicine diagnosis for me to have that information. A lot of people have shoulder pain and there's different reasons for it. So I need to know why your shoulder hurts so that I can treat it effectively. In Chinese medicine, we do treat the whole person. So I have to diagnose your whole body, not just that shoulder that hurts. Next, we'll do a physical exam. I'm going to weigh you. I'm going to take your blood pressure, your pulse, your heart rate. I'm going to look at your tongue. In Chinese medicine, we do that. You may, when you have a sore throat, go to the doctor and they ask to see your throat. Not the same thing. I'm going to look at your tongue, top and bottom, and then I'm going to take your pulses on both wrists. So I'm going to feel in 3 different locations on each wrist at 3 different levels. That gives me a lot of information about what's happening inside your body, and again, helps me to diagnose. If you are coming in for pain, back pain, shoulder pain, knee pain, I'm going to do what's called range of motion testing. So I'm going to have you move that limb or that joint through a series of movements to see where you're at, so we can get a baseline before we start treating. I'm also going to palpate. I'm going to feel the area that you're coming in for. What I'm feeling for is muscle tension or any softness in that muscle that shouldn't be there. That's also going to give me a lot of information on how to treat you properly. Then it's time for treatment. I have really comfortable spa chairs, not just the normal massage table. It's a spa chair. You sit up. You're going to have 8 different positions for your back. I have a pillow for under your knees. It's really comfortable, I promise. I'm going to clean the points with alcohol. If you're allergic to alcohol, I'll use betadine. If you're diabetic, I'll use betadine as well. I use what's called clean needle technique. All acupuncturists do. It's something we're trained in way back in school in the beginning, and it's ingrained in us. It's clean needle technique. The needles are only used once. They're never used again. They're incinerated after we send them off. So you don't have to worry about anything like infection because we're really careful about that. Next, I put the needles in. Some people are afraid of needles. You don't need to be. When people think of needles, they think back to their childhood or when they bring their kids in for their vaccinations. Nothing like those. My needles are very, very thin. Most people don't feel the majority of them that go in. Some of them you might feel a little pinch, but it's not bad and it goes away really quickly. Once those needles are in, I'm going to turn on some heat lamps. It's going to be nice and relaxing, and you're going to rest for anywhere from 10 to 25, 30 minutes. Depends on what we're treating you for. After that, I'm going to come back in and I will take the needles out. You might have some bleeding, and that's not an uncommon thing. I use cotton balls to make sure that we stop that bleeding right away and prevent any bruising. And then you'll be able to just get up and go. Most of the needles I put in are from the elbow down and the knee down, and I also do some in the face that are really relaxing too. I do use other modalities, and that depends on what you're coming in for and what's appropriate for you. So you might get cupping Tui Na, which is Chinese medicine massage, not a relaxing massage. It hurts, but it's effective. And I might do something called gua sha, which is scraping. It just depends on what you need. I also might recommend herbs or supplements for you if they're appropriate for your care. So we'll take care of all that. We'll go back out to the desk. We'll take care of any payment, and we'll reschedule your next appointment. It's really easy. Hope to see you soon. My name is Donna Winges, Back to Balance Acupuncture. We use pins and needles to help you avoid the knife.